almost all the literature I have read on financing for mental health and mental and neurological health says it's underfunded. However, if you compare the levels of funding, the higher income countries are investing proportionately more in mental and neurological health than low and middle income countries.
What would be good for countries to improve their performance, and I really would like to see this in a policy position, is for a commitment for all countries to produce this type of evidence and present the arguments and work with government officials that kind of can see and collaboratively generate the evidence together.
How are we doing in Kenya, and what are the challenges, if any?
In terms of mental health financing, we are not doing well. Looking at the percentage of budgetary allocation, we are less than 1%. We should be getting, in terms of Kenyan shillings, 250 shillings per capita per individual.
The idea, which is in a lot of low and middle income countries, is that a lot of the funding is going to the psychiatric hospital, because mental health is understood more as inpatient care for severe disease and not in promotion and prevention or community care.
Let me hear a bit from Professor about how these low resource settings, low income countries can overcome those constraints by using evidence.
The key is first to make the investment case to advocate for prioritizing mental health. Why it should be? Because many governments in low and middle income countries are probably not totally aware. They may be making a lot of assumptions.
Unless you have a focal person with the ear of the policy maker, your agenda will be slower than it would otherwise be.
We are trying to partner with the government to actually do a national survey so that we can have local numbers to build our case upon, because we're dealing with estimates and then people don't take estimates seriously.
How you actually go about making an investment case is primarily done based on burden of disease, but sort of make investment case in terms of where exactly in terms of services should this money go.
We need to think about financing modalities to go beyond grants. And here what I'm advocating is we need to think about innovative financing tools.